Welcome back guys, this is Dr. G again. Now in this video, we'll be discussing mainly important topics that you should know before going to the exam. Fmge December 2024 exam. See, these are the must and should know topics before going to the exam. Okay. So let's start with general physiology. In general physiology, if you ask me, so tell me one question that will come for sure. If you ask me, one question will be pakka coming from the topic of transport across the cell membrane. Okay, transport across the membranes, like active transport, passive transport. In active, there is primary active transport, secondary active transport. In diffusion, in passive transport, there is diffusion, simple diffusion, facilitated diffusion, osmosis, vesicular transport. Okay, this topic is of utmost importance. So let's go in order. In general physiology, okay, in general physiology, if you ask me how many marks will be coming in exam, somewhere around 3 to 4 marks. 3 to 4 marks will be coming from general physiology. In general physiology, the most important topic is transport. From the topic of transport, one question will be pakka. Okay. Next, the next most important topic is cell membrane. Okay, cell membrane and cytoskeleton. Cell membrane and cytoskeleton. From this, you can expect one MCQ. In the topic of cell membrane, what are the components of the cell membrane? What is the composition? They will ask how much amount of proteins are there, how much amount of carbohydrates, how much amount of lipids are there. In proteins, what are the different types of proteins like integral proteins, transmembrane proteins, peripheral proteins, lipid anchored proteins. Different types of proteins you should know. Okay, and different types of lipids. What are the examples of different phospholipids, different glycolipids. Okay, important points about the cholesterol in the cell membrane. You have to know these things. So you can expect one question either from the cell membrane or cytoskeleton. From the topic of cytoskeleton, they will ask about microtubules, microfilament, intermediate filaments, the transport across the transport within the cell. That's a retrograde transport with the help of dynein, anterograde transport with the help of kinesin. So these things you should know. Okay, so you can expect one question either from cell membrane or cytoskeleton. Next most important area is cellular fluids, or better word, body fluids. Okay, so in the topic of body fluids, even the recent Fmge exam, there was a question on transport, there was a question on body fluids. Okay, so in body fluids, what you should know? The composition. How much is intracellular fluid? How much is extracellular fluid? What are the different indicators used to measure the intracellular fluids and extracellular fluids? Okay, the formula to calculate the plasma, and Darrow-Innes diagram in the topic of body fluids, Darrow-Innes diagram. Okay, so these are the important things which you should know. After body fluids, definitely one question will be either coming from, one question pakka either coming from muscle. See, I am including muscle and nerve here in the general physiology, general topics itself. Okay, one question will be coming from muscle physiology and nerve. Okay, so you should be very good with your muscle physiology, especially skeletal muscle, and after that you can also go through the smooth muscle and cardiac muscle. Mainly concentrate on the skeletal muscle. They will ask about the sarcomere, what are the different components of the sarcomere, composition of the sarcomere, different bands, A band, I band, H band, okay, Z lines in the center, M line, what happens during the muscle contraction, how these bands are going to vary, okay, what are the different components which are present in the skeletal muscle that are absent in the smooth muscle, okay, and about the cross bridge cycling, that is cross bridge formation, later cross bridge detachment, power stroke, okay, where ATP is needed, where ATP hydrolysis is needed. So those topics you should know in the muscle physiology. Okay, one question will be either coming from muscle physiology or nerve physiology. In the nerve physiology, most important topics are the action potential of a neuron. Next, refractory periods, absolute refractory period and relative refractory period you should know. Next, different types of nerve fibers, classification of nerve fibers. Okay, so these are the important topics which you should know. See, in general physiology, 3 to 4 marks will be coming, and these are the areas. One question will be pakka coming from transport, one question will be pakka coming from body fluids, and one will be coming from the muscle physiology and nerve physiology. If they are giving 4 questions, one will be also coming from the cell membrane and cytoskeleton in general physiology. After general physiology, let's start with the systemic physiology. In systemic physiology, let's start with the cardiac physiology. Okay, cardiovascular. So, what are the most anticipated areas? Okay, most anticipated areas in the cardiovascular physiology. First one, cardiac cycle. Cardiac cycle with heart sounds. See, I am specifically mentioning the heart sounds here because you should know in which phase you will hear S1 heart sound, S2 heart sound, S3, S4. Okay, so cardiac cycle is the one important area which I want you to know along with the heart sounds. After cardiac cycle, the next most important area is JVPs, jugular venous pressure changes. You know what are the positive waves, what are the negative waves? Okay, C wave in JVP, you know A, C, X, V, Y, right? A, C, X, V, Y. These 5 waves when they are going to be seen. When you are going to get the C wave. Okay, C wave is going to be seen in which phase of the cardiac cycle? A wave is seen in, V wave is seen in, Y wave is seen in, and abnormal JVPs. In tricuspid stenosis, what kind of changes? In tricuspid regurgitation, what kind of changes? Okay, in atrial fibrillation, what kind of changes? In third degree heart block, what kind of changes? So, normal JVP and abnormal JVP you should know for your exam. Okay, cardiac cycle, JVP. After this, cardiac reflexes. Okay, cardiac reflexes. What are the cardiac reflexes? Cushing reflex, Bezold-Jarisch reflex, Bainbridge reflex. You have to know that. After cardiac reflex, the one more important area which usually they ask the questions is from the action potentials topic. Action potentials of SA node and ventricular myocyte. Okay, action potentials of SA node and ventricular myocyte. This is the important area. They will ask the pacemaker potential. The pacemaker potential in SA node is due to depolarization, is due to repolarization, is due to in SA node. Same about the ventricular myocyte also. Resting membrane potential, how much? Depolarization is due to. Next, plateau phase is due to. Repolarization is due to which ions? So, such kind of questions can come up in your exam. So, these are the most important cardiac cycle, JVPs, cardiac reflexes, action potentials of SA node and ventricular myocyte. Apart from them, okay, once you are good with this, also cross check whether you are good at, okay, whether you are good at the concepts of preload and afterload, baroreceptor reflexes. Okay, baroreceptor reflexes. Where are the baroreceptors located? What are the afferents in the baroreceptor pathway? What is the center in the baroreceptor pathway? Baroreceptors are sensitive to, okay, these areas regarding the BP. Okay, BP and baroreceptor reflex you should be good at. After that, cross check whether you are good at left ventricular pressure volume loops or not. Okay, left ventricular pressure and volume changes. There is a topic called as left ventricular pressure volume loop. First, be good with this cardiac cycle, JVPs, cardiac reflexes, action potentials of SA node, AV node. Most probably you will be getting questions from this area. And before going to the exam, just cross check whether you are good in BP topic, blood pressure and baroreceptor reflex. Are you good in left ventricular pressure volume loop, concepts of preload and afterload? Okay, and in the vascular physiology, are you good with the Poiseuille-Huygens formula? Okay, in the Poiseuille-Huygens formula, they will be like asking questions like what happens if the diameter of the blood vessel, doubles, what happened to the resistance? If the diameter of the blood vessel doubles, what happened to the blood flow? Okay, so such kind of questions will be coming up in your exam. Okay, so these are the important things in cardiovascular physiology. After this, in respiratory. In respiratory physiology, the most important topics before going to the exam, the most important topics in the respiratory physiology. First topic is surfactant. Okay, what is the composition of surfactant? Who produces the surfactant? Where is the surfactant stored? What is the relationship between surfactant and compliance, surfactant and surface tension? Okay, you should know this. All about the surfactant. Who increases the production of surfactant? Who decreases the production of surfactant? Okay, well, these are the important things which you should know about the surfactant. The most important thing, surfactant. Next, after this, lung volumes and capacities. Lung volumes and capacities. Spirometry curves. Okay, they will talk about the spirometry. Like they will give you the spirometry graph and they will ask you to mark tidal volume. What is inspiratory reserve volume? Expiratory reserve volume. What is vital capacity? What is functional residual capacity? Okay, that they will ask you. Next, after this, V by Q ratios. V by Q ratio. What is the normal V by Q ratio? What is the normal ventilation? What is the normal perfusion? What is the normal ventilation by perfusion ratio? Okay, you know it's a 0.8. In the apex of lung, what is the normal ventilation perfusion ratio? In the base of lung, what is its value? In a patient who is having pulmonary embolism, what happens to the VQ ratio? In a patient who is suffering with atelectasis, what happened to the VQ ratio? In a patient who is having a foreign body obstruction, what happened to the VQ ratio? Okay, in which conditions VQ ratio is going to be 0? In which conditions VQ ratio is going to be infinite? Okay, what happened to the ventilation perfusion ratio in dead space? So VQ ratio is important topic. After that, the most, if I am the examiner, I will give question from this. Okay, repeatedly tested MCQ, that is oxygen, hemoglobin, association, dissociation curve. Association, dissociation curve. Okay, oxygen, hemoglobin, association, dissociation curve. I hope you have gone through this topic. You know, there is something called as a right shift. In which conditions right shift is going to occur, in which conditions left shift is going to occur. Okay, that's the oxygen, hemoglobin, association, dissociation curve. This topic will be coming along with the transport of the gases. Okay, transport of the gases, how oxygen is transported, how carbon dioxide is transported. In the oxygen transport topic, you will get this oxygen, hemoglobin, association, dissociation curve. What is Haldane's effect? What is Bohr's effect? Okay, these are the topics which you should know in respiratory physiology. See, there are even other important topics, but before going to the exam, are you good with these topics or not? Just cross check. Okay, after respiratory physiology, now endocrine. See, in endocrine physiology, the recent exams, 4 questions came. In the recent exam, 4 questions came. One question was asked on the intracellular secondary messengers. Okay, one question was asked on the secondary messengers. One question was asked from the growth hormone topic. Okay, what are the conditions in which growth hormone is elevated? What are the conditions in which growth hormone is decreased? One question was asked there. And regarding primary hyperthyroidism versus secondary hyperthyroidism, recently one question was asked. And one question was asked from the adrenal gland, histology of the adrenal gland. They gave the histology of the adrenal gland and they have marked the adrenal medulla and they have asked what are the substances which are secreted from the adrenal medulla. 4 questions came. Okay, so endocrine is also utmost important. No, the most important hormones that you should know: growth hormone, in and out. Okay, what are the conditions in which growth hormone is elevated and decreased? What are the functions of the growth hormone? Growth hormone, it affects on its effects on blood sugar levels, growth hormone and protein, protein synthesis, growth hormone and lipolysis. Okay, what I want you to know is what are the actions of the growth hormone. Okay, how growth hormone is produced, what are the different conditions in which growth hormone is produced, like fasting, hunger, releases ghrelin, ghrelin stimulates the growth hormone, sleep, especially NREM stage 3 and 4, sleep stimulates the production of growth hormone. After taking protein meals, growth hormone is released. Okay, after doing exercise, after stress, after in trauma conditions, okay, in all these conditions growth hormone is elevated. Okay, so regarding growth hormone, along with the growth hormone, insulin like growth factor. So when the growth hormone is acting on the liver produces insulin like growth factor. Okay, know about growth hormone and insulin like growth factor. After that, thyroid hormones. One question will be pakka coming from thyroid hormones. Next, insulin. So you should know everything about the insulin. Everything. What are the actions of the insulin. How insulin is going to reduce the blood sugar levels. Okay, how insulin enters into the liver first. Okay, sorry, not liver, the pancreas. How insulin is going to enter into the pancreas by using which transporters? Like glucose transporter type 2. This insulin, how it is going to, sorry, not insulin is going to enter into the pancreas, how glucose is going to enter into the pancreas, and how this glucose is going to release the insulin. So everything about the insulin you should know. How insulin is going to decrease the blood sugar levels. Next, what are the different changes that insulin brings in the body? Like what are the reactions insulin stimulates in the body? What are the reactions which insulin inhibits in the body? What is the relationship between insulin and potassium? What exactly happens in the diabetic ketoacidosis? Okay, in a DKA patient, what will be seen? Okay, what is the most common cause of death in DKA patients? Recent question. So everything about the insulin you should know. After insulin, also know about the adrenal hormones. Okay. Recently, what they have asked is adrenal gland histology. I have already told you. So adrenal hormones, the steroids, adrenal cortex. There is something called as the zona glomerulosa fasciculata reticularis. Zona glomerulosa produces the mineralocorticoids. Zona fasciculata produces the cortisol. So everything about the aldosterone, the conditions in which aldosterone will be excess, Conn syndrome. The conditions in which the aldosterone will be deficient, Addison's disease, adrenal insufficiency. Okay, what are the conditions in which the cortisol rises, Cushing syndrome. So you have to know about everything about these adrenal hormones also. After this, you can expect the most important area, calcium homeostasis. Calcium homeostasis regarding parathyroid hormone. How parathyroid hormone is going to achieve the calcium homeostasis along with calcitonin and vitamin D. So calcium, very important for the exam. Calcium homeostasis. Right? So these are the important things in endocrine physiology. Okay. Next, GIT. In the GIT topic, the number one important topic, the number one preference that I will give to GIT motility. The topic of GIT motility. Okay, the topic of GIT motility. Next, iron. Okay, the topic of iron absorption. Where iron is absorbed, in which form it is absorbed. Okay, iron, it is transported with which plasma protein in the blood? Iron, where is it stored? Recently they have asked what substances decreases the iron absorption. Okay, iron is stored in which form in the liver? Iron is in which form in the hemoglobin? Fe2 plus form. If it is changing into Fe3 plus form, it causes methemoglobinemia. So regarding iron, important. Not only iron, you have to know the substances like iron absorbed in duodenum, folic acid absorbed in jejunum, maximum water reabsorbed in the jejunum, and cyanocobalamin, vitamin B12 along with the bile acids absorbed in the ileum. So different substances and their absorption sites. So these are the topics which you have to know. Okay, the substances and the absorption sites. So GIT, motility, that is peristalsis versus segmentation. Next, iron absorption topic, very important for the exam. And after this, in GIT, I want you to know that different cells in the gastric glands. Okay, different cells in the gastric glands and their secretions. The gastric glands and their secretions. For example, like acid is produced from the parietal cells, mucus is produced from the foveolar cells, pepsinogen, okay, pepsinogen, and gastric lipase is produced from the chief cells, gastrin produced from the G cells. So like this. So different glands and their secretions you have to know. Okay. Next, so these are the most important topics in the GIT, gastrointestinal physiology. You will be getting 2 questions from the gastrointestinal physiology. GIT may two questions will be coming, and in respiratory physiology you will get somewhere around 3 questions, and same 3 questions will be coming from the cardiovascular physiology, 3 something like that. Okay, the range can be different. Sometimes they will change. Next, renal. In renal physiology, the most important topic that I will choose, if I am the examiner, I will give the question from the cystometrogram. Many times the question has been asked from the topic of cystometrogram. Okay, cystometrogram. how the volume and pressure changes within the bladder, cystomatogram. This is the important topic. Next, in the recent Fmge exam, how many questions came from the renal physiology? 5 questions came from the renal physiology. 5 questions. Okay, directly 5 questions came. You should know what are the important topics that you should know. Listen, know about GFR. What does I mean by GFR? How GFR is auto-regulated? Auto-regulation. The topic of auto-regulation, that's something called as tubuloglomerular feedback. How tubuloglomerular feedback is causing the auto-regulation of GFR. How myogenic hypothesis, there is something called as a myogenic hypothesis or myogenic mechanism to auto-regulate the GFR. Next, changes in the GFR. How GFR change? Okay, how GFR change whenever the person is having shock with afferent arteriolar constriction. With afferent arteriolar constriction, how GFR changes? With afferent arteriolar dilation, how GFR changes? With efferent arteriolar constriction and efferent arteriolar dilation, how GFR is going to change? How GFR is going to change when a person is having high protein diet. So these are all the topics of GFR. Okay, everything about the GFR. The formula for the GFR, formula UV by P. In the recent Fmge exam, 2 questions came on GFR. With efferent arteriolar constriction, initially GFR increases, later decreases. One question. The formula to calculate the GFR, UV by P. Same question was asked in the exam. Okay, the same formula UV by P is also used to calculate the clearance. Recent exam question. Okay, so everything about the GFR you should know. Main important topic, cystomatogram, later GFR. After this, be very good with PCT. Which part of the nephron? Proximal convoluted tubule. Okay, proximal convoluted tubule. How much percentage of the substances are getting reabsorbed? How much sodium, how much chloride, how much water, how much amino acids, how much glucose, how much bicarbonates are getting reabsorbed? Which substance concentration increases in the PCT? Which substance concentration decreases in the PCT? PCT may what kind of epithelium is there? Okay, so these are the topic. Like every topic about every point about the PCT is important. After PCT, in the TAL, thick ascending limb of loop of Henle. In thick ascending limb of loop of Henle, there is a transporter called as NKCC, sodium potassium 2 chloride importer. That is very important. Okay, ascending limb of loop of Henle, what are the different types of transporters present? Which substances are getting reabsorbed? What happened to the urine concentration? Urine, is it getting concentrated or diluted? So that you should know. DCT. TAL, thick ascending limb. After this, be very good with the topic of last topic. In the renal physiology, we will be discussing about acid-base balance. Kidneys have a role in the maintenance of acid-base balance. So, questions on acid-base balance. Okay, so how kidneys are balancing your pH? You should know how to do the calculations. So, they will give you a calculated based question. They will say something pH is so and so, PCO2 is so and so, like bicarbonate so and so. So, you have to say whether the person is having acidosis. If it is acidosis, respiratory acidosis or metabolic acidosis. If it is alkalosis, respiratory alkalosis or metabolic alkalosis. So, you should know how to calculate. Okay. So, in the topic of renal physiology, cystomatogram, GFR changes, PCT, acid-base balance topics. Okay. So, these are the important things that I want you to know. Apart from this, look, always better to know differences between Barter, Gitelman. Barter versus Gitelman. Barter versus Gitelman. Where Barter is having the problem, where Gitelman is having the problem. Next, Liddle syndrome versus Korn syndrome. Because all these disorders, whatever I am talking here, all these disorders, they are all having one thing in common. All are having hypokalemic metabolic alkalosis. The first two are hypotensive disorders, other two are hypertensive disorders. So, know them. Next, SIADH versus diabetes insipidus. So, most probably you can expect one question from them. Okay, either directly from physiology or directly from medicine. One question you can expect most probably from SIADH versus diabetes insipidus. In one condition more urine production, other condition no urine production. So, these are the important topics from the renal physiology. After this, let's see important topics from the nerve physiology, central nervous system. So in the topic of central nervous system, you have to know different types of touch receptors. Okay, you have to know about the different types of touch receptors like Meissner's, Merkel, Pacinian. So questions will be coming from there, like where exactly 2-point discrimination is maximum for reading Braille script. What kind of touch receptors are required? So touch receptors topic important. After this, you have to know about in the sensory nervous system proprioceptors. Proprioceptors along with reflexes. For example, like stretch reflex. Stretch reflex, what is the receptor involved? Inverse stretch reflex, what is the receptor involved? Okay, in the recent Fmge exam, muscle spindles innervated by gamma motor neurons. Muscle spindles are receptors. They will detect the length. Okay, of the muscle fiber. In stretch reflex, the receptor is muscle spindle. So you have to know about the reflexes. Stretch reflex and inverse stretch reflex, very, very important for the exam. After that, you can expect a question either from ascending tracts / descending tracts. Okay, ascending tracts, descending tracts, important areas. See, these topics will anyway integrate with the anatomy also, neuroanatomy also. So be good with ascending tracts. What are the spinothalamic tracts and what are the corticospinal tracts? Okay, spino to thalamic, ascending tracts, corticospinal tracts, descending tracts, and also be good with the extrapyramidal tracts. Okay, extrapyramidal tracts originating from the brainstem, coming down into the spinal cord. Okay, and along with the descending tracts, you should also know about what are the upper motor neuron lesions, what are the lower motor neuron lesions, how the tone is going to change, how the reflexes are going to change, what kind of paralysis is going to be seen, whether the fasciculation seen or not, in which kind of lesions there will be a Babinski sign positive. So differences between upper and lower motor neuron lesions, ascending tracts and descending tracts you should know. Okay. Next, anything else? Say, you should know about EEG, electroencephalography. Okay. All important points about the EEG waves, alpha, beta, gamma, delta, theta waves, in which conditions they are going to be seen. EEG integration along with the sleep. Okay, EEG integrate with the sleep. So, in sleep, there are different phases. NREM sleep, REM sleep. NREM was further divided into N1, N2, N3. Okay, according to the new classification, N1, N2, N3. In N1 sleep, which kind of EEG waves are seen? In N2, which kind of EEG waves? In N3, which kind of EEG waves? Okay, in sleep, integrate with the hormones. What hormones increases and what hormone decreases? Sleep and parasomnias. What are the parasomnias with abnormalities? Parasomnias are seen in which kind of sleep? Okay, parasomnias are seen in which kind of sleep? The parasomnia is seen in NREM sleep and parasomnia is seen in REM sleep. Dreams occurs in which sleeps? Dreams remembered in which sleep? So everything about the sleep you should know. Now after sleep, also know about the hypothalamic nuclei. Okay, also know about the hypothalamic nuclei. Say they will ask the anterior nucleus of the hypothalamus, what it will do. Posterior hypothalamic nucleus, what it will do. Lateral hypothalamic nucleus, supraoptic nucleus, ventromedial nucleus. Okay, so they will ask different nuclei and their functions. In the recent exam also they have asked hypothalamus is a thermoregulatory center. Anterior nucleus cools down the body. Posterior nucleus warms up the body. So hypothalamic nuclei, very, very important for the exam. Okay, and last, basal ganglia. Okay, basal ganglia. So you should know basal ganglia mein there is something called as a direct pathway which facilitates the movement, indirect pathway which inhibits the movements. So no important points about the basal ganglia. What are the components of the basal ganglia? What are the functions of the basal ganglia? What happens if the caudate nucleus of the basal ganglia is damaged? What happens to the putamen if it is damaged? What happens to the subthalamic nucleus damaged? So it's going to cause the involuntary movements like chorea, athetosis, hemibalismus. So what is normal and what is abnormal about the basal ganglia? Not only that, I want you to know in the topic of the same brain, where exactly is the post-central gyrus located? Okay, post-central gyrus, and what is the function of the post-central gyrus? And what is the function of the precentral gyrus? Where exactly is the Broca's area located? Where exactly is the Wernicke's area located? Okay, also know about something called as a law of projection and phantom limb phenomena. in the central nervous system. So, if you are good with this, the 6 systems: cardiovascular system, respiratory system, endocrine, GIT, renal, and central nervous system. Okay, central nervous system. So, if you are good with the six systems, okay, 6 systems and general physiology topics, anyway I have told you 3 questions will be coming from the general physiology. 1 question will be pakka coming from the topic of transport, and 1 question will be pakka coming from either from nerve physiology or muscle physiology. 1 question will be pakka coming from the body fluids, and 1 will be either from the cell membrane or cytoskeleton. Okay, I am not going to the in detail things. Okay, in detail I am not going. We will have the in detail topics like the rapid revision kind of thing. Okay, rapid revision kind of thing before the exam. But just cross check. Still you are having 3 months of time. Just cross check whether you have gone through all these important topics or not. Okay, so having said that, guys, keep on repeating, keep on doing the repetition. More the number of times you repeat, more better result you will get. Follow strictly one notes. Strictly follow one teacher notes. All teachers are good, no doubt in that. Only stick to one notes. Do questions only from one Q bank. Okay, either online Q bank or offline Q bank. Just only choose one Q bank. One Q bank. Okay, don't jumble from here and there. There are multiple Q bank options available. So usually students will be doing some questions from so and so Q bank, some questions from so and so, some questions from the offline books. So don't do it. Will unnecessarily eat your time. Okay, right now time is limited. So follow one author or one teacher, one Q bank, and must and should, before going to the exam, you have to do the last 5 years of PYQs, last 5 years of NEET PG PYQs and Fmge PYQs. Okay, so if you do this, your preparation of physiology is done and dusted. Okay, okay guys, all the best. Thank you.